Hi, everyone. Welcome back to the Doc Talk podcast. I'm Dr. Shazma Mithani.
And I'm Dr. Sheila Wijaya-Singha.
A special thank you to today's episode sponsor, Figs. So obviously in our line of work, we kind of live in our scrubs. And if you follow us on Instagram, you probably already know this by now. We are obsessed with Figs. They're super comfortable, breathable, durable, and they actually fit, which is just a huge upgrade from those horrible itchy scrubs that were so status quo for so long. They're also super cute and stylish, and you just feel good wearing them, you know?
And like you said, Chaz, we're obsessed. But you know what I love most about Figs? They just get what it's like to work in this field. It's not just that they know what we need, like 7 pants pockets to carry around all our instruments, but they also have built this incredibly supportive community of people who want to have important discussions and make real connections with people who work in healthcare. I've been to a couple of their events, and it's so refreshing for a brand to show up in such a real way. And if you're not following them on social media, their memes are amazing. If you work in healthcare or know someone who does, Figs is it. And right now, if you go to wearfigs.com and use code FIGSCA, FIGSCA, you can get 20% off your first order. That's wearfigs.com, code FIGSCA. So today we're getting into something that I know a lot of my family members and patients are asking about in terms of how to stay healthy during the holidays and what we see in clinics and what you're seeing in the emergency room during the holidays.
Yeah, and this is I'm so glad we're talking about this because it's such a challenging time for the entire healthcare system. So in the Emerge, we're seeing such high volumes because clinics have shorter hours. People can't necessarily get in to see their family doctors. And so access to primary care gets limited, which means people come to the ER with all these holiday gatherings. And then, of course, respiratory virus season as well. The volumes we just see go up.
Yeah, it's really hard. And I understand that too, Shaz. Like I know your shifts will shift during this time of year. As a family doctor, our shifts also change and our coverage isn't as great as it normally is during the year. So people do struggle and layer in all the other things that come at this time of year, right? Like the icy sidewalks, the bigger meals, the viruses that you mentioned, the travel that you might be taking or disrupted schedules. And this time of year is really, there's a lot of pressure on this time of year, emotionally and physically. So it's a lot.
It is a lot. I mean, so I usually work during Christmas and then have New Year's off. We usually have to work one or the other. And Christmas is a busy time. The holidays in general are a busy time. So today we're going to take a bit of a different angle on our episode. We're going to go through different patterns that we consistently see in the ER, in the family doctor's clinic throughout this time of year, and what advice we can give you to help avoid those ER visits and help seeing me and my colleagues. So we'll dive right in here. This is something that we see a lot. You know, Sheila, you mentioned kind of heavier meals. We see GI issues, things with like food, heartburn, and GI chaos come in a lot during the winter months and especially during those December holidays. With those meal inconsistencies, you throw in alcohol in there, irregular eating times, and then stress of like all of the family drama, potentially getting shopping lists done. There's
what
a
family
lot.
drama?
So, what family drama? I know, right? Nobody has family drama over the holidays. And so your GI system reacts to all that. And we often see people coming in with symptoms related to that.
Yeah, same thing over here in family practice. What I'm starting to really see is, and especially in that couple of weeks around Christmas and New Year's, is people often sort of wait because they don't want to come in. They're with their family. They assume that things are going to settle. And so they've had symptoms for a few days and they're kind of deciding, is this just heartburn or am I actually having a heart attack? Which, to be quite honest, is something that we want to help distill for you because this can be very anxiety provoking already.
Absolutely. And I mean, like when I see people come into the ER, so someone that might have had a missed heart attack, they kind of brush it off thinking that it's indigestion or heartburn and then delay care. And so there is a few things that are important to kind of think about when you're deciding when you should come into the ER, whether it is just a GI thing or whether it could be something more serious. And so if your symptoms tend to occur like right after a large meal and improve pretty quickly with antacids, it is more likely that it's reflux. But that being said, if the symptoms are new, you've never had them before, even if if they feel like indigestion, but you're not a person who gets indigestion, if they're persistent, so they don't go away, they kind of are associated with things like sweating or nausea or shortness of breath, especially in women that tend to have a bit of like a different pattern of symptoms, not the usual classic symptoms for heart troubles, then it's really important to get assessed in those scenarios.
Yeah, and that takes us back also to our previous episode on heart disease, Shaz. So I encourage everyone to go back and take a listen. We also talked about the risk screen tool from the Heart and Stroke Foundation. So if you're sitting around and looking for something to do, this is a good opportunity over the holidays to just do a quick assessment. And also one of the things, Shaz, like we say this a lot, like trust your body. Don't sit on your symptoms for a lot of days just because, our clinics may not be as accessible. That's how people end up sicker. So do seek out care if something feels off.
And Sheila, so I mean, I know that, so for me in Emerge, like I'm telling people when to come to the Emerge, what can we tell people in terms of like how to manage things when you're eating, when you're having these holiday meals to try to prevent coming in to see someone like me?
Yeah, so these are things that I say to myself as well and to my family members and to my children. Slow down while you're eating, hydrate before and after your meals, stay upright after big dinners. Like if people, all you want to do after you've had a big meal is lie down on that couch and just kind of
Yeah,
by
I
the
know I want to
fire
do
and
that.
cozy up. But when you
Yeah.
lie down after a big meal, you're more likely to have that reflux, like the acid can come up the esophagus and you can taste it. So you want to kind of like stay upright after a big dinner for about 30 to 45 minutes. And then keep antacids or reflux meds on hand because you never know when you might need it. And we certainly see the use go up during the holidays. And then again, sort of like limiting alcohol intake can be helpful and paying attention to your symptoms earlier rather than waiting until like day 3 of symptoms to get support.
Yeah. So like I really want to drive that point home. If the symptoms aren't going away after like even an hour or two, that is really a thing to get assessed for because heart pain can mask is that kind of GI pain as well. All right. So let's switch gears right away here. So as an Emerge doc, I see a lot of people slipping on the ice. So I live in Edmonton here. And so typically what happens is everyone kind of assumes that Edmonton is always cold all the time, but it's not. We often have these freeze thaw cycles where it's kind of hovering around 0 and then it gets icy and slushy and then it gets cold overnight and then you get a dusting of snow on top and then it hides all this ice that's developed over time. And so we often in the Emerge see a lot of slips and falls. And then there's also the decorating injuries. Everybody wants to hang up their lights. They want to do things in their house and use things to climb up. And then there are falls associated with that. So this is a pretty common injury that we see in the ER during this time of year.
Oh, I can only imagine. And like for the record, for everybody, chairs aren't ladders. So if you are, and I have to use that rule for myself as well, it's easier to grab a chair and climb up to decorate or put the star at the top of the tree or whatever it is.
I'm guilty of that too, I have to say.
Listen, like I always actually get my husband, and I shouldn't get the kids to do this because they're too small, but sometimes they'll kind of like watch me. That's not a good thing. So chairs aren't ladders. We're also guilty of this. It's easier to do that. But if you need height, use something designed to actually get you up there or have somebody kind of spot and can make sure that that chair is steady if you have to use it because ladders can be difficult to come by as well.
And then the thing is, I mean, like often these are happening on hard surfaces, right? So people are like using chairs or climbing up onto the countertops. Like just earlier this week, I saw someone who was using the counter to like reach up high. They fell backwards, smoked the back of their head, had a big laceration. And so these are things that can lead to like very severe injuries, broken bones. And so, I mean, when we talk about icy sidewalks in the Emerge, I see people come in. The most common one is those wrist fractures, right? So they're falling, the foosh injury. So the fall on the outstretched hand. You fall forward, you put your hands out to brace yourself, and then that wrist takes the impact, and there's a very specific fracture that can happen with this. So not only do we see wrist fractures, we can see ankle injuries from falling funny with your like kind of foot going in or out one way or the other as you're slipping or falling. Head injuries, like I mentioned, you're slipping backwards instead of forwards and falling and smoking the back of your head on a hard surface. And we're all, I mean, the holidays are so busy, so everyone's often like rushing and multitasking, and then trying to order something on your phone as you're walking and not paying attention, and then there you go, it's an injury waiting to happen. Yep.
Yeah, you must see so many slip and falls injuries actually in the winter months especially. We are seeing more of it in Toronto right now because it's a colder season for us this year. What we're also seeing is a lot of people will sort of delay care again because maybe they haven't been able to access care or get that appointment, but they've been limping for a few days and they thought, the pain's just going to fade away. But the key thing that we want to like take home here is that if you can't weight bear after falling or slipping, or the swelling is really significant, don't wait to get care. Come and get it checked out. It certainly could just be a sprain, but we always want to rule out if it's not a fracture. So Shaz, like, how do you tell people? I'm curious. I do my preventative care piece on my end, but when you're talking to people, how do you get them to stay safe and avoid seeing you in the Emerge in terms of slip and fall accidents?
So, I mean, if we start with slips and falls outside, like with icy sidewalks, if you know that there are people coming over, I often have my parents come to our home as well. So I'm like on it with telling my husband to like get so salt, if you're like in a more of like around 0, let's get into the chemistry of it, but like around 0 salt, so like in Toronto is going to be more effective. But if you're constantly frozen, salt is only going to like lower the freezing point.
Oh, that's a good point.
Yeah. And so like in places like Edmonton, sand or gravel is actually better, right? Because you're not going to actually get that ice to melt with salt because it's too cold for that to happen. So sanding or icing the sidewalks, like shoveling first as much as you can, and then sanding or icing the sidewalks to help just have some traction. If you or yourself are out, or like remind your aging family members to wear good gripped boots or shoes, or winter boots tend to not have a lot of tread on them. So getting those ice cleats that you can kind of just put on around and then using those to walk. I actually like gifted both of my parents a pair of these so that they now use over the winter months. If you're in the house, use an actual ladder or a step stool, not a chair. Don't climb up on the counters. This is just a fall waiting to happen. And then, like you said, Sheila, if you do fall, if you notice that your wrist doesn't look the way that it should, or it's more swollen and that swelling is not going away, you can't use it. Or if you're, if you have a lower body injury where you can't walk or weight bear, that is a reason to get assessed. And then, of course, please keep basic first aid supplies at home. Like even if you cut yourself after a fall, you still need to be able to manage that bleeding as you're waiting to go into the ER to get stitches done. And so keeping things like gauze, making sure that you have ice around if you've sprained an ankle or you're worried about breaking a broken bone, just those are things that are going to help as you're trying to go into the emerge or waiting to get into the emerge as well.
That's awesome, Shaz. Thank you for those tips. We're going to switch over to viral season and talk a little bit. We've talked about this as well. One of our first episodes of the season was on cold season and flu season. And, December is peak respiratory season. It's actually predicted in Canada that we are going to be peaking for flu and other respiratory illnesses in December. And so we're in it right now. And think about flu, COVID, RSV, and the usual colds, school closures, family gatherings, all the school concerts before school closes. Like everyone is together in one space. And travel also accelerates the spread. And it often hits households all at once. So kids, parents, grandparents, we're seeing this in our practices. I'm sure you're seeing this in the emerge and seeing multiple family members at the same time. What are you seeing, Shaz?
So that's exactly what we're seeing. So like December is where we really start to see ramped up numbers, like escalating numbers of influenza right now for sure. RSV, yes, COVID is starting to taper off a little bit, but we are seeing very, very high volumes. I've been working all week, very high volumes, and everyone is swabbing positive for influenza. And they're sick. They're sick when they come in. And so what that means in terms of what we're seeing in the ER, people coming in with dehydration, if they have an underlying lung disease like asthma or COPD, they're coming with flares of that, with difficulty breathing, even if you don't have an underlying lung issue. With infants, if they have RSV, we're seeing feeding issues and breathing issues. And then fever. So what we typically find with influenza is that these fevers are lasting more than just 1 or 2 days. They're lasting sometimes up to a week. And as you know, if you've listened to our previous episodes, that threshold is around 4 days. And so if you have a fever for more than that, that's when you need to be seen. And we are seeing a lot of patients come in with that too.
And we have a fever episode as well. So we're just kind of referring back to all of our episodes because we've hit a lot of these topics in a deep dive. So if you have questions about that, our episode just recently aired on fever. So take a peek at that. Also, one of the things, Shaz, that we really emphasize is on vaccination, because we know that vaccination makes an impactful difference around prevention of these respiratory conditions. So getting your flu shot, updating your COVID vaccines, these things will reduce severity, complications, and hospital admissions.
And, there's been a lot of talk about the influenza vaccine, like not really covering things well this year. Fair, sure. So like it's only about 30 to 40% effective. However, it still will reduce your severity of disease. So even though it might not completely prevent you from getting influenza, it will still prevent severity, complications, and hospitalizations as well. So really, really important to get vaccinated for influenza. And if your infant qualifies, getting that RSV vaccine as well, because this is something where we see a lot of young babies come into the emerge with this.
And I think a lot of families are recognizing this. And I've noticed an uptake in our own practice that people are getting that RSV vaccine. Our elderly patients are getting the pneumonia vaccine if they're due for that again. So these are things that we can really work together as a community to keep each other safe. What we wanted to do right now is actually share a little tip, side note here. Shaz and we chatted about this, that one of the things that we often do to get like each of us in our own homes is to make sure that our home has been well supplied, to have supplies ready when they may be sick, because this is when your clinic might be closed or pharmacies might be closed because they have different hours. You want to have something at home to help you during that time.
I think this is such a good point to make, because you get sick on Christmas Day or like New Year's Day when everything is closed. It's a stat holiday. You can't get access to the things you need. And so can you tell us, Sheila, what is in your kit at home for like fever, pain, respiratory symptoms?
Yeah, so I always make sure before the holidays hit that we have our pain relievers and our fever relievers. So acetaminophen or ibuprofen. We have a thermometer, and especially a thermometer that has a battery that works, because we've gone through it so much, that make sure that you have a battery in that works for you. We have electrolyte packages as well. Like our family just had gastro a few weeks ago, so we have to restock all of that because we want to rehydrate in those situations. And really the focus is on fluids. And so electrolyte packages. Nasal saline sprays is one thing that I've really started to incorporate this this year much more after that study that came out in the UK around decreasing the level of length of time infections will linger. And so we're nasal spraying ourselves with saline rinses all the time in our home. And so that's something that we update as well. Having a humidifier we have that. It's a working humidifier. And we also have honey, especially for those of you who may have kids over the age of 1. This is what you can use to help with coughs that happen as well. And if you have anybody in your home, and certainly in our home, we have this, having a working inhaler and a spacer for kids. So those are things, if you have kiddos who might suffer with a little bit of a prolonged cough or have asthma, having a working inhaler, because you don't want to run out of those things during the holidays.
Mm-hmm. Yes, this is your reminder that if you do have a child or someone in the house uses an inhaler, to check to make sure that it hasn't run out, because that is also a common reason that people come into the ER, that their inhalers run out, and then there's no way to get it, right? So good kind of reminder for everybody to check that.
And what do you think, Shaz, in terms of, like, you mentioned minor injuries behind, and when you mentioned earlier where you said if you cut yourself, you want to be able to support yourself. So what do you suggest for things like minor injuries or other sorts of things?
Yeah, so I mean, having ice, right? So like ice at home, or like one of those like cold packs, is really valuable if you have a sprain or something that's swollen and where the skin is not cut. If you're worried about like bruising or swelling, that's going to help with pain, especially if it's not something that you think needs to go to the emerge, or if you're waiting to get to the emerge, that's going to help with the swelling and the pain. A tensor bandage will help just for comfort as well, kind of in the aftercare. And then just basic wound care supplies, so gauze, Band-Aids of all different sizes, steri strips. So these are something that you can get from the pharmacy that will kind of help keep a wound closed that doesn't need stitches. And then if we kind of think about GI illnesses, right? We are going to see a lot of GI illnesses throughout the holiday season as well. So we talked about that reflux, so having antacids on hand, things like Gravol, if you're having someone in the house with vomiting, or like even the ginger version of Gravol, there is good evidence for ginger as well. And then the rehydration fluid. So you mentioned, Sheila, those electrolyte packs. And so, for example, like Pedialyte or a similar brand, they do have just powders that you can mix with water rather than having like the bottles of it on hand. It's a lot easier to just keep around and just use it when you need it.
Yeah, that's really helpful. This is a long list. And actually, I was thinking we could actually put this on our show notes this time around, just so that people have a list handy as well. So if you are looking for that list, you don't have to write it all down. We'll have it in the show notes section as well. The last thing I would just want to mention, Chaz, is what we've also alluded to, is that pharmacies also close down sometimes during this time of year and just have different hours. So making sure that you have that 1 to 2, if you have any chronic conditions like high blood pressure or heart disease or anything else like diabetes, make sure that you have a buffer of medication during this time. A couple of weeks supply is important. Again, those rescue inhalers, migraine medications, your EpiPen, and a printed medication list is always helpful to have on hand in that health, like the holiday health basket.
For sure.
And it's also important to, like, even having half of this list, you don't have to have all of it, but even having a little bit of this list can help you keeping out of that emergency room.
Absolutely. I mean, like, really, when it comes to most viral infection, it comes down to fluids, rest, and breathing support, and of course, time. And so having these basics at home are really going to help you manage that and ideally keep you out of the ER.
So one of the biggest things that we see during the holidays isn't just like the physical challenges that people may experience. It's also the emotional challenges. And December carries a heavy load for so many people for different reasons that sometimes we can tend to underestimate the impact.
And, you know, I think I'm glad that you brought this up, Sheila, because in the ER, we see so many consequences of this. Like, there is an increase in mental health presentations in the ER over the holiday months with things like panic attacks, kind of episodes of depression as well. I mean, there are lots of potential triggers that happen over the holidays, whether it's like a lost family member that maybe has been lost around the holidays previously or in the year before, and it's like a first holiday without a family member. It's like often a time that we think about lost family members during the holidays. And so that can often be a trigger for things like anxiety or depression. We'll often see alcohol related visits. People are drinking a lot more, or, you know, using alcohol as a crutch or kind of as a way to numb certain stressors that are happening over the holidays. Burnout, of course. I mean, we see this not only in healthcare workers, but beyond. There's like, the holidays are just a busy time for everybody. And so people really feel this pressure to power through when they actually need support. And then it all kind of comes to a head and they end up requiring emergency care from a mental health standpoint.
Yeah, I'm so glad that we're talking about this piece as like a closing in a way too, because it is such an important piece, and it's not the most wonderful time of the year for people, and there's an expectation that we love this season, and people often will share with me that they feel guilty that they don't love this season. And the truth is that you're not alone if this season isn't for you, or it's hard. This is a very difficult time for so many, where people will feel overwhelmed, lonely, or financially stressed as well, and there are supports out there.
And, with limited mental health access over the holidays, people often do end up in the ER because they just don't know where else to go. And we are happy to see you there. So, Sheila, can you like, if you have patients that might be at risk of having some decompensation kind of over the holidays, are there any things that you recommend to them to kind of stay safe over the holidays and avoid crisis and coming into the ER?
Yeah, I mean, I think the first thing is always like get that extra support. And if you know that this is a time of year that's difficult for you, I'm always super grateful to my patients when they share that with me. I check in a little bit more during this time because I know it can be difficult. But when you bring it up to your doctor or nurse practitioner or your care provider, it's helpful to actually for us to know, because then we can help you as well and make sure that we are maybe setting up an extra appointment or checking in close to the after the holidays are done, just so that we can have that follow up with you. I think personally, I always try to suggest to people to be gentle with themselves over the holidays. So like reducing the expectations that you may place on yourself. It's okay to set boundaries around what you're going to be committing to. Share those responsibilities that you may have. I know a lot of people carry a lot of responsibilities in their home, and share them or minimize them before you hit that breaking point. Build in time for rest. So we tend to overschedule during this time as well, because we just want to see as many people as possible sometimes, or there's a lot of like kids activities or other things on your plate, but it's okay to like make sure that you carve out time and schedule rest time. And you mentioned it too, alcohol itself in that moment can help sort of numb some of the difficulty that we have, but in the end we know it actually has a depressive effect and can make you feel worse. And so if you are noticing that you're leaning on alcohol a little bit more, or substances a little bit more, it's an indication to maybe get some of that extra help and reach out for help early to friends or crisis lines or to your family doctor as well.
And I think we should end with alcohol, because it is something that we see a lot more of over kind of use of alcohol over December and alcohol related emergencies. And if you haven't already listened to our recent episode on alcohol guidelines, please be sure to take a listen for a deeper dive on this, because it does have a lot of really great evidence-based information in there.
Yeah, that was one of my favorite episodes, just to be able to share, because it really made me reflect also on my own use as well. And we know that the mix of stress, poor sleep, heavier meals, and alcohol really do catch up quite quickly. And there's something called the holiday heart, which is an irregular heartbeat triggered by drinking. And that's something that we see in our office, but also I'm sure you see that quite a bit too, Shaz, in the Emerge.
A lot in the emergence. So it's basically like alcohol can have a kind of detrimental effect on the heart rhythm. It can trigger something called atrial fibrillation, especially if you're already prone to it, but even if you aren't. And it's typically caused by like large amounts of alcohol or a change in what your baseline is. And so even if you are someone who drinks chronically, if there's like a binge of alcohol that happens, that can really trigger this arrhythmia in the heart. And then people come into the ER to see me. And so it's challenging, because like emotionally, alcohol often makes everything harder. And it feels like it makes things easier, but then it can actually have a lot of detrimental effects. It's not a coping strategy. It's really just this temporary numbing agent with like significant potential rebound effects.
And so when you're seeing patients, Shaz, what do you suggest to them around alcohol use during the holidays, especially?
Yeah, so I usually tell people to kind of like know ahead of time how much they're planning on drinking. And I think going in with that mindset of saying like, I'm only going to have 1 drink, 2 drinks, whatever that number is, just knowing ahead of time, because then you're committing to that rather than being, in this party type environment. The drinks are often flowing. People are often handing you or offering you drinks. And then it's hard without like having this known limit beforehand to just like set this boundary. So doing that ahead of time is actually really, really valuable and really helpful. Make sure you're alternating drinks with water or with non-alcoholic drinks. So, we talked about this in our episode on the alcohol guidelines. There's a lot more availability of really great, well-crafted non-alcoholic beverages. And like whenever I have people over now, like our bar fridge, like yes, there's beer and wine, but there's a ton of non-alcoholic beverages stocked in there as well. And that's usually what I offer to people first. So thinking about that as a host as well, make sure you eat before drinking, because that can help delay the effects or slow down the effects of alcohol rather than just drinking on empty stomach. It can cause that spike in your blood alcohol level a little bit faster. And then, of course, if you do end up feeling like you have this holiday heart where you're feeling like your heart's beating really fast and it doesn't settle, that is absolutely a reason you should come into the ER. All right, so to wrap up this episode, let's do a quick holiday true or false based on true patterns that we see in a clinical setting. So Sheila, you ready?
Ready.
Okay, so true or false, most injuries happen before the holiday gathering.
So this is true. Rushing, lifting, organizing, December becomes an accidental high-intensity workout. So be careful even before the holidays.
Mm-hmm.
Okay, Shaz, so true or false? ERs are the busiest on Christmas Day.
That is false. So I actually love working Christmas Day because it is often the slowest day of the holiday season. People usually come in kind of like the 24th and then definitely the 25th are the slowest because people are like with their families and like don't want to go into the ER. The busiest day is often Boxing Day. So everyone is like just trying to get through the holidays, just trying to like get there, or like, you know, the 22nd, 23rd when people are trying to get their issues sorted before all the family comes over. But typically it's Boxing Day because everyone's trying to hold on for as long as they can with themselves or with their sick family member. And then Boxing Day is usually very chaotic. So Christmas is usually not too bad. It's the days leading up to, and then definitely Boxing Day that's really, really busy. All right, Sheila, true or false? Patients across Canada are quietly resenting Elf on the Shelf.
Yes, true. As somebody who somehow got into doing Elf on the Shelf, love it for like the joy that it brings my kids. But oh my gosh, every night I'm like, what are we going to do? So it adds another thing. I should follow my own advice and just sort of like minimize stresses for next year. But it does add to parental burnout.
That elf needs a union representing it.
Gosh,
those
honestly.
poor elves. Oh my goodness.
True or false, Shaz? Holiday heart syndrome is real.
True. So alcohol, dehydration, and stress, these can have pretty significant impacts on the heart and can cause an arrhythmia called atrial fibrillation.
So we really love doing this episode because we also feel the stress of the holidays and we are with you as working moms and just kind of get through each day. So we hope that you have a really gentle holiday season. And here's a holiday prescription that actually works, Shaz.
So hydrate, sleep when you can, prep a small home health kit, ask for help early and often. Please lower your expectations. We can't do everything. Schedule that rest in as well, and then treat your mental health the same as you would your physical health. And of course, remember the system is stretched at this time of year. A bit of planning can save you hours of waiting and really reduce that stress when it comes to health over the holidays.
Thanks everyone for listening. Please follow, rate, and review us and send us your questions. We love hearing from you.
Wishing you all a safe, steady, and genuinely enjoyable holiday season with fewer mishaps and more rest.
And thank you to everyone for tuning into the Doc Talk podcast. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs.
And make sure to follow us on social media at the Doc Talk Pod. And of course, like, subscribe, and review us wherever you get your podcasts.